Welcome again to the 30th Annual Public Health Symposium. I want to thank Kendra Julian, Colleen McKay-Wharton, Megan Rockefeller-Baldoni, Laura Warner, and the entire Center for Public Health Workforce Development staff for all they've done to make today happen. Well, someone just blinded me, so thank you, everybody. So our Dean, Perry Halkitis, sends his regards and his regrets for not being here. He's out on travel this week, but he is here to support you and to engage with our public health community across New Jersey. And he certainly misses being here and would love to say hello to all of you. I do want to recognize our public health partners in New Jersey, the New Jersey Public Health Association, the New Jersey Association for County and City Health Officials, New Jersey Environmental Health Association, and the New Jersey Society for Public Health Education. You guys are on the front lines doing public health every day, and we are glad to be able to partner with you in many ways to assure that the public health programs and activities across the state happen. You guys are really amazing, and we're lucky to have such a strong community-facing public health community in New Jersey. If you're not getting the legislative emails from our associations, you go get them. If you're not completing the alerts that go out, where all you have to do is put your name and email and address in it, sign up for them. We need your support to do that. If you're not reaching out to your federal legislators, go to their website and submit it and say, we need your support for public health. Without that, we're in trouble. So please go do that. Also want to thank our IT staff. Thank you, guys. I want to thank all of our exhibitors and poster presentations. Thank you for being here. Thank you for sharing your work with us. And please, during lunch and breaks, go out and look at the posters and engage with our colleagues at their tables. So lots of good stuff out there. You know, when I thought about when we were planning this, you know, it's the 30th anniversary, and you know, those numbers that would end in zeros or fives seem to be times that are bigger than other times. And we were looking at a big celebration, a huge celebration, 30 years. We saw the dedication to Shirley Smoyak, who passed away a couple of years ago. Shirley really was the instrumental in bringing this to New Jersey during the first public health week in the United States. So we have been I would go on record, if anyone can prove me wrong, go for it, that we are the only organization that has done Public Health Week symposia since the first year. And being together today is really important. Being able to console each other and to be with each other and to strategize with each other is really important. Over the last week, we have seen and felt the devastating cuts to public health. The list of programs that were eliminated at CDC, HRSA, FDA, and others is too long to read, but it includes 42% of the senior staff at CDC, including the National Center for Chronic Disease Prevention and Health Promotion, the National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention, 92% of the National Institute for Occupational Safety and Health, the Office of Communications at CDC, gone. The Office of the Chief Operating Officer, which includes the Freedom of Information Act office, gone. And the list goes on. These cuts are just so devastating, and just being, it's really hard to just comprehend all of this. You know, when websites and freedom of information is cut, where are we getting the information from? Who's managing that information? And what's the message that we're getting? The HHS director says he wants to reverse the chronic disease epidemic. This is great, but how do you achieve that? When funded programs in Alzheimer's, arthritis, prevention research, alcohol use prevention, epilepsy, chronic disease education, and awareness are cut. Joe Biden said in his fiscal year 23 budget remarks, "Don't tell me what you value. Show me your budget, and I'll tell you what you value." So what's valued by this administration? We hear talk about making America healthy. We hear talk about focusing on chronic diseases, but we see reductions and elimination of funds. We see elimination of workers who are there to protect the health of our population. And we see the impact that trickles down to the states when federal programs are eliminated. We feel the significant impact of the rescission of $350 million in funds to New Jersey. Our state and local health departments, which are significantly under-resourced, now need to find a way to survive. This year, New Jersey has a gubernatorial election. We have 11 people running for governor. What's their position on public health? How do they expect to ensure that the work that needs to be done to protect New Jersey citizens will take place? How do we fill the void created by the lack of federal public health funding? This is a significant challenge, but with significant challenges come opportunity. It's hard to see that when we're in the thick of it fighting for our lives. We need to reevaluate the way that we do things. We need to understand how we can fund public health in a more sustainable way. And we need to say to our leaders, what do you value? And put the money where your values are. In the words of Jerry McFire, show me the money. So welcome to our Public Health Symposium. Our topic this year is the work ahead, practical strategies for long-term impact. We are part of the Region 2 Public Health Training Center, which is funded by HRSA at the moment. Hopefully that continues. Those centers have been in effect for, since 2001, so 24 years these centers have been around, providing public health training, and it allows us to do the work with you to provide training, technical assistance, and other work with the local health departments and local public health people across New Jersey. Our partners is with Columbia University, New York State Association for County and City Health Officials, Impactivo in Puerto Rico, and of course the Rutgers School of Public Health. We are going to call up Lisa Gala. We have a joint legislative resolution of the Senate and Assembly, and Lisa representing New Jersey Public Health Association. New Jersey Public Health Association celebrating 150 years this year. So we're proud to be a member of New Jersey Public Health Association. If you're not a member, dues are very cheap. See Lisa, go to the table, and Lisa, I'll turn it over to you. If you want to say a couple words about NJPHA, go ahead.
So yes, and we have a QR code to make life easier for everybody. But thank you very much for having us here. Not only am I here representing New Jersey Public Health Association, which was one of the first and oldest public health associations and affiliates with American Public Health Association. So we have a brief history out there if you all want to check it out. It's a really exciting and interesting history. I think in response to some of what Mitch is talking about, I think it's important to know that the very first meeting of the American Public Health Association was held here in New Jersey. And the members of New Jersey were founding members of APHA. So it's a really rich and exciting history we have here in New Jersey, and I think just to echo some of Mitch's words, I think it's really important that we now use this time to honor what they did for prevention of public health and make sure that we keep fighting the good fight. So I'm very excited. And on behalf of not only NJPHA, but, and I'm not going to go down the list Mitch already said, but our organizations that are combined as the Public Health Association's collaborative effort, I want to thank everybody also for being here. And I want to read the State and General Assembly Joint Legislation Resolution for Public Health Week. We are very honored to have both Senator Scutari and Assemblyman Coughlin get the joint legislatures to approve this resolution for us. So if you bear with me, thank God I've got my glasses now and I can read it for you. All right, so whereas National Public Health Week will be observed within the Garden State and across the nation from April 7th to 13th, 2025, and will center on the theme, It Starts Here. And whereas the Senate and General Assembly of the State of New Jersey are pleased to recognize public health workers upon this auspicious occasion, which marks the 30th anniversary of the annual celebration and is a fitting time to recall the significant strides that have been made during the past 3 decades. And whereas some of the many accomplishments in the nation's public health sector since 1994 include a notable reduction in transmission and deaths due to HIV/AIDS, a drop of more than 50% in smoking rates, and a decrease in childhood mortality and lead poisoning, as well as improved awareness and treatment of mental health conditions, greater recognition of the health impact of climate change, and a growth in pandemic preparedness, especially after the COVID-19 pandemic. And whereas, despite these important achievements, racial and ethnic minority populations continue to experience disparities in the burden of illness and death, with health status varying drastically from town to town across the United States. And as a result, National Public Health Week aims to raise awareness of this and other issues and to educate policymakers and the public so that together we can overcome a wide range of health threats and transform the focus of the health system from treatment of disease and injury to prevention and promotion of wellness. And whereas the strength and prosperity of the state of New Jersey and the vitality of our American society greatly depend upon concerned and industrious individuals exemplified by our public health professionals who devote their time and energies and utilize their unique skills in furtherance of the common good. And whereas it's altogether proper and fitting for the members of this legislature to pass in their deliberations to acknowledge the 30th Annual National Public Health Week and praise the tireless efforts of our public health professionals which have served to support the well-being of us all. Now, therefore, be it resolved by the Senate and General Assembly of the State of New Jersey that this legislature hereby recognizes National Public Health Week, pays tribute to the meritorious service, leadership, and commitment of public health professionals, and encourages New Jersey residents to participate in this important observance, and be it further resolved that a duly authenticated copy of this resolution be signed by the Senate President and the Assembly Speaker and attested by the Senate Secretary and Assembly Clerk. Thank you.
Thank you, Lisa. If you're a member of Public Health Association, New Jersey Public Health Association, please stand. Thank you for being here, and we're very glad that we've had our state affiliate around for so many years, and looking forward to continuing to engage with the New Jersey Public Health Association for the next 150 years and beyond. Thank you all for that. So, we talk about trust the science and confidence in science. This Pew Research study from 2024, just 4 months ago, November, it shows that confidence in science is waning. And over the years, especially during the COVID years, you can see the numbers going down. Should scientists be involved in policy? Americans are split on this, about 50-50. Where 48% say focusing on establishing sound scientific facts and stay out of policy debates, or versus take an active role in policy debates. So it's about split. So when you look at the different sides of the aisle, you get a different picture here. And you can see Democrats and lean Democrats are much more in favor of taking an active policy, of scientists taking an active role in policy, and that percent who say scientists have not enough or too much influence in policy debates. So you can look at the numbers there. So how do we bridge the divide there? And I think that's going to be part of our talks today, is how do we talk to each other? How do we look forward to engaging about the issues that need to be talked about? And how do we come to a common ground? Those are hard questions. And we live in a time of much more divisiveness, social media posts, easy to put things out there, whether they're true or not. So there's a lot of things we're battling. But we need to look at what values are, and seeing where science isn't policy, right? Science is the fact. Science is data. Policy is science and values. Without those values, you're missing out. Or values are what creates the policies. It's back to the quote before. Show me what you spend your money on, and I'll tell you your values. That's what we're looking at here. How do we get values across and become shared values that can come into policies that protect our citizens and protect public health? So we want to remember Shirley. We spoke about her, and really I learned so much from her over the years, and we're indebted to her to have this symposium. Now just a couple of logistical things. For continuing education credits, there's the New Jersey State Nurse Association credit statement. You can read that. Program evaluation, you'll scan the QR code. This will be posted later too. And we've got our presenters. So our first presenter today is Rena Chudgar, and she's the Senior Director of Public Health Systems and Services at the Public Health Accreditation Board, where she facilitates the implementation of the FAP Center for Innovation and incubating the Center for School Health Innovation and Quality. She supports systems, health departments, and communities through initiatives by fostering innovation, multi-sector collaboration, system change, and public health modernization and transformation. She previously served as the Director for Performance Improvement at the National Association of County and City Health Officials, and she has international experience. And so, Rena, please come to the podium.